My name is Natalie Cantrell. I'm a student with Mississippi University for Women. I'm going to do my physical head to toe assessment on my husband here. His name is Ben. And we're going to start with the head and the face and the neck. So I'm just going to inspect his head. Everything seems to be symmetrical. No nodules, no lumps, no abnormalities. Palpate his scalp. Nothing feels abnormal or out of place. His head is evenly contoured and symmetrical. Okay, I'm going to inspect his face. It's symmetrical. He's got just a normal expression on his face. I'm going to palpate his temporal arteries. Everything was within normal limits. I'm going to palpate his TMJ. Open your mouth. Close it back. There's no popping or grinding. Okay, we're going to assess the cranial nerve 5. Clench your teeth for me. I'm going to try to open your mouth and just, okay. Cranial nerve 5 is intact. Close your eyes for me and tell me when you feel the cotton ball.
Feel it.
Okay.
Feel it.
Okay. I'm going to move on to cranial nerve 7. I'm going to have you smile, frown, close your eyes tightly, raise your eyebrows, show your teeth, and puff out your cheeks. Okay. Cranial nerve 7 is intact. We'll move on to cranial nerves 3, 4, and 6. We're going to test your 6 eye fields. Just look at my finger for me. Just follow my finger. Don't move your head. Okay. All right. I'm going to inspect your eyebrows and your eyelids. Everything looks normal, symmetrical, no abnormalities, no nodules or anything noted. I'm going to feel of them. No abnormalities noted. Okay, just open your eyes for me. Let me check your conjunctiva, and your sclera and irises and your pupils. Everything looks good. Okay, I'm going to move on to your ears now and inspect them. They're both symmetrical, no abnormalities noted, no knots, no nodules. Any tenderness?
No.
Okay, no tenderness noted. Okay, now we're gonna check cranial nerve 8. This is the whisper test. I'm gonna cover each of your ears and whisper a word to you. You tell me if you hear it, okay?
Hello. Football.
Okay. All right, we're gonna move on to your nose. Inspect it. Symmetrical, no abnormalities or anything noted. Everything feels good. Is it tender at all?
No.
Okay. All right, I want you to cover up one nostril. Blow out for me. Breathe in. Now close the other nostril. Blow out and breathe in. Both nostrils are patent. I'll move on to your sinuses. I'm going to check them. Any tenderness noted?
Mm-mm.
No nodules, no lumps, no abnormalities noted on palpation. Okay, I'm going to inspect your mouth and your throat. If you will, just open your mouth for me. Stick your tongue out. Tongue is pink and moist. Buccal mucosa is pink and moist. The hard palate is pink, shiny, and moist. Okay, look at your gums. Gums are pink, shiny, and moist. Okay, move on to cranial nerves 9 and 10. Open your mouth for me one more time. Stick out your tongue and say ah.
Ah.
Okay, uvula moves upon its vibration upon the word ah. Okay, we're going to check cranial nerve 12. Stick your tongue out for me. Tongue is symmetrical. Any tenderness noted when you stick your tongue out?
Nope.
No abnormalities noted to the tongue. We'll move on to the lymph nodes. No swollen or enlarged lymph nodes noted upon palpation. Okay, move on to cranial nerves 11. Touch your chin to your chest for me. Move your head to each side. Okay, raise your head back up, head to each side. Touch each ear to each shoulder. Okay, head backwards. Okay. Now I want you to move your head towards the right side. Okay. Head towards the left side. Okay. Alright. Move on to your trachea and your thyroid. Trachea is palpable, but no abnormalities noted. Thyroid is palpable but not enlarged. No lumps or nodules noted. Okay. I'm going to check his carotid pulse, inspect it. Carotid pulse is noticeable to inspection. Carotid pulse can be felt upon palpation. Okay. I'm going to auscultate now for carotid bruits. Okay. No bruits noted. At this time, I'm going to inspect his posterior chest wall. If you'll just turn around for me. Turn around a little more. Okay. As you can see, there are no abnormalities noted to his posterior chest wall. Chest wall is symmetrical. The skin is intact. No scratches, no bruises, lumps, nodules, or anything like that is noted. Okay? I'm going to palpate against your chest wall here and just say the word 99 for me.
99.
And again.
99.
Okay. Tactile premises is intact. Take a big deep breath for me. There is symmetrical expansion of the lungs noted to the posterior chest wall bilaterally. Okay. Percussion is within normal limits to the posterior chest wall. Any tenderness noted here?
Nope.
Okay. No flank tenderness noted on the costovertebral angle. Okay. Deep breath for me. And again. 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 Another deep breath. And one more. Okay. You can turn back around for me. This time we're going to move to your upper extremities. If you will, just stretch out your arms for me here. I'm going to inspect those. Arms are symmetrical bilaterally. Skin is intact. No bruising. No skin tears. No lumps or nodules noted. Any tenderness? Okay. No tenderness noted to palpation. Okay. Just rest your arm. Relax your arms for me. This time I'm going to feel your brachial arteries. Radial arteries, I'm sorry. Radial arteries are strong and equal bilaterally. Move on to your brachial. Brachial pulses are strong and equal bilaterally. Okay, just raise your hands for me. I'm going to test capillary refill. Capillary refill is less than 2 seconds in each digit. Okay, at this time we're going to check the range of motion in your shoulders. If you will, flex your arms above your head for me. Both of them. Okay, you can put them back down to your side. Hyperextend them to your back. Okay, stretch your arms out. I'll bring them back into you. Okay. Range of motion is equal bilaterally. Is there any tenderness noted? Okay. Alright, we're going to check the range of motion with your elbows, if you will. Flex your elbows for me. Extend them. Okay. Turn your hands over. Turn them up like this. Okay. Now flex your elbows for me. Okay. Extend them. Okay. Any tenderness noted?
No.
Okay. We'll move on to your wrists and your hands. Okay. Flex your wrists for me. Extend them. Okay. Spread and open your fingers and close them back. Okay. Now touch each finger to your thumb. Okay. Any tenderness noted? Range of motion is equal bilaterally in the wrists and hands. Okay. Stretch your arms out for me like this. Each index finger to your nose. Okay. All right. So we're going to check the anterior. You can put your arms in. We're going to check the anterior chest at this time. There are no abnormalities noted to his chest. No bruising, no skin tears, no lumps or nodules noted. Any tenderness? Okay. All right. Just breathe for me. Okay. He has normal work of breathing. He is within defined limits. He's not struggling for breath, no labored breaths or anything like that. Okay, if you will, just lay back for me. I'm going to inspect and palpate your precordium here. No heaves or thrills noted. Okay. At this time I'm going to listen to your heart. We're going to listen to the aortic, pulmonic, mitral, and tricuspid valves. S1, S2 heart sounds are noted to be equal and strong throughout all fields. I'm going to listen with the bell of the stethoscope now. Heart sounds are equal and strong with the bell of the stethoscope as well. Okay, you can sit up for me. We're going to move on to your abdomen. I'm going to inspect the skin of your abdomen. No abnormalities noted, no skin tears, no bruising, no nodules or lumps noted. Any tenderness?
No.
Okay, no tenderness noted. There is no visible peristalsis or pulsations noted to his abdomen. Okay. If you will, lay back for me again. I'm going to inspect his umbilicus at this time. His umbilicus is within defined limits. No hernias noted. No abnormalities noted. No tenderness upon palpation. Okay. At this time, I'll listen to your bowel sounds. Bowel sounds are equal and active, not hyper or hypoactive in all four quadrants. Okay. All four quadrants of the abdomen have equal percussion sounds. Okay. Now listen to the aorta. Aorta and renal arteries noted to be within defined limits. Okay? At this time, we'll move on to palpation of your abdomen, okay? This is going to be very light. You tell me if there's any tenderness to any of your quadrants. This is a light palpation. Is that tender at all?
No.
Okay. This is going to be a deeper palpation, so it may be a little more uncomfortable. Okay. No lumps or nodules noted to the abdomen upon deep palpation. We're going to palpate your liver now. Liver is palpable but not noted to be enlarged or with any lumps or nodules. Okay, you can sit up now. Just stretch out your legs for me. Stretch them out. We're going to move on to your lower extremities. I'm just going to pull your pants up here. Okay. Lower extremities noted to be within defined limits and equal bilaterally. No skin tears or bruising noted. No lumps or nodules or abnormalities felt upon palpation. Okay, at this time I'm going to check your arteries or your pulses. Popliteal, posterior tibial, and dorsalis pedis pulses noted to be equal and strong. I would give them a 2+ bilaterally. We're going to palpate for edema. There's no edema noted to either leg. Okay, just lay back for me. Okay. Extend your right leg up 90 degrees. Okay, your left leg. That was knee to chest. So we'll do the leg up 90 degrees. Okay. Now your right leg. Okay. Alright. So you can sit back up. We're going to test the range of motion in your feet. So we're going to do plantar flexion and dorsiflexion. So extend your feet out for me. Flex them in. Okay. Turn your feet in towards each other and out away from each other. Okay. Now pull against my hands and push against them. No abnormalities noted. Range of motion is equal in both feet and ankles. Was there any tenderness or pain noted? Okay. Okay. All right. So what we're going to do this time, I want you to take your right heel and run it down your left shin. Okay. Do the same with your left. We're testing cerebellar function. No abnormalities noted. Okay, so stand up for me if you don't mind. Just back up a little bit. Walk a short distance on your heels. Okay, and turn around and walk on your toes. Okay, hop on one leg. Okay, now hop on the other. Okay, now turn around for me. We're going to inspect the spine. Spine is noted to be straight. No curvature noted to the spine. No abnormalities noted to the spine. Okay, if you will, bend forward and touch your toes for me. Okay, stand back up. Bend sideways to the left. Bend sideways to the right. Bend backwards. Okay, and twist your shoulders to each side. Any tenderness noted?
No.
Okay, you can sit back down. Physical assessment performed proved to be within defined limits. There were no abnormalities noted with the patient from head to toe. Thank you.